Can a large hole in the septum be repaired? The simple answer is yes. However, perforations over 2 centimeters in size are more difficult to repair. Why? Well, perforations that are less than 2 centimeters have plenty of surrounding tissue on the septum, the floor of the nose, and the outer walls that you can recruit to repair the perforation and sew things back together in a pretty straightforward, though technical manner. When the perforations exceed 2 centimeters in size, you really are having encroachment onto the healthy tissue that you would usually use to repair the perforation, meaning the amount of healthy tissue is very scarce and the size of the hole is very large. In those cases, you may have to recruit tissue from outside of the nose to help repair the septum. Although in many cases it's not necessary, but that surgery is definitely more complicated. It's in your best interest to have your perforation evaluated as soon as you can. If you know that you've been told that a perforation is, let's say, 1 centimeter, you shouldn't put your mind at ease. That's when you want to get an evaluation, because that means that you have a high chance of having a successful operation to repair that perforation. If you wait for a perforation to go from 1 to, say, 5 centimeters, the chances of you having a successful operation get very, very low. And so my advice is, as soon as you know that you have perforation, suspect that you have a perforation, or have been told by another physician, that you see a specialist right away. A common question is, can a perforated nasal septum heal on its own? Unfortunately, it's not possible for a perforated septum to heal spontaneously. The only way for it to heal is with surgery, by bringing the edges of the perforation together so that it can heal naturally without any tension. The problem with the perforation is that the opening is filled with empty space and air, which swirls around inside the perforation and prevents the edges from coming together and healing properly. So unfortunately, watching and waiting and hoping that the perforation is going to heal with the passage of time is not really a good method for treating your perforation. So I recommend getting it evaluated, getting the size measured, and coming up with some treatment options as soon as you figure out that you have a septal perforation. Can I feel a perforated septum? Well, that depends on what we mean by feel. Patients with septal perforations will often feel that the nose is dry. They may have crusts that build up in the nose that they feel they need to clear. And they also may have a sense of whistling or a change in the shape of the nose that may kind of prompt them to know that they have a perforation present. The septal perforation can often be palpated too with a finger, although I highly recommend against you putting your finger in your nose to feel the perforation, because you may damage the sensitive lining of the nose and actually cause the perforation to become infected or increase in size. So the short answer is, you can feel symptoms of a perforation, and you often can feel the presence of it digitally, but I recommend that you have a physician do a full evaluation to diagnose the size of the perforation and its severity as soon as possible. Can I fly with a perforated septum? That's a great question. There may be concern if you have a perforated septum that you may have an increased possibility of having sinus infections or increased pressure from the flight taking off or landing. The reality is that a septal perforation generally will not cause you any more sinus pressure or increase your chances of getting a sinus infection. But because of the dry air in the cabin of the airplane and just the air conditioning units in the airport being very cold, you may experience a lot of drying during your flights. So I recommend you using some type of nasal moisturizer and maybe a saline rinse to help you be more comfortable during your flight. Can I get a hole in my nose from picking it? Yes, you can. And this is called rhinoplasty. It's a fancy name for nose picking. It's one of the most common causes of a septal perforation, and the mechanism of action is the finger or the fingernail inside the mucosa of the septum causes a slight laceration or a tear that needs to heal. And when it's healing, it forms a scab, which for someone who's a nose picker may be even more irritating than the septum being irritated or itchy in the first place. When that scab is picked off, they cause bleeding and another scab forms, and you get a shallow indentation in the septum every time you pick off a scab before it's completely healed. Over time, you develop a small hole that leads to a septal perforation. That's why it's very important to understand that nose picking is highly not recommended, and you should avoid it at all times. The better way to clean your nose is with nasal saline in a tissue and blow gently to clear any secretions, mucus, or crusting that you may have in the nose. Putting the finger in the nose is the fastest way to get a perforation, or to make a perforation that you have that's very small much larger and possibly infected in the future. Can I get a septal perforation from a septoplasty? The answer to that question is yes, and it's actually one of the most common causes of a septal perforation. This may occur after a rhinoplasty, sinus surgery, or a septoplasty directed at a surgery for a deviated septum. The surgeon may inadvertently damage the lining of the septum, causing a small opening that fails to heal, and that can lead to a septal perforation, and it's very common and could be the most common cause of septal perforation. Can you live with a perforated septum? Absolutely, but your tolerance of the perforation are going to be dependent on several factors. Number one, the size and the cause of the perforation. If it was caused from a surgery or substance abuse, you may experience more symptoms than a patient who perhaps got a septal perforation from just picking the nose, or potentially from the use of nasal medications such as nasal steroids or decongestants. What's the difference? Well, in the cases of substance abuse or surgery, there's a lot more trauma that's happened, not just to the perforation, but to all the tissues inside the nose, either from the procedure or from the substance abuse such as cocaine affecting all the tissues in the nose. What's the difference? Well, in the cases of surgery and substance abuse, you have a decreased ability to kind of bring oxygen and healthy nutrients to the area that would minimize the amount of symptoms that you would have in the case of a septal perforation caused by surgery or substance abuse. In the case of nose picking or potentially abuse of nasal medication such as Afrin or Flonase, those perforations usually are only caused by a traumatic injury to a small area of the nose. The rest of the tissue inside the nose is relatively healthy and has minimum symptoms. In those two cases, the difference is that patients who have a perforation that's isolated with a generally healthy nose can tolerate their symptoms for much longer and may not even know they have a perforation for a long period of time. Patients who have a perforation from cocaine use or after a rhinoplasty, septoplasty, or sinus surgery may notice symptoms pretty quickly, and they may be very severe. Either one of those cases, I recommend you have an evaluation to know what condition your septum is in and how long you can kind of prolong getting a definitive treatment if that's your choice. If you choose not to have any treatment at all, doing nothing is probably not a reasonable option. You're going to have to manage it medically, meaning using nasal saline to keep the nose irrigated and flushed and free of any crusting or mucus that's building up in the perforation. And then also, you're going to have to provide some form of humidification and moisture so that the nose stays at a nice, moist level and you're not building up a lot of uncomfortable dry air and mucus and crust that can lead to further symptoms such as foul-smelling odors, crusting and bleeding, and just a general sense of nasal obstruction. Patients will often ask who are interested in a perforated septum surgery, how can my perforated septum be repaired, or what's the surgical treatment for a perforated septum? Those are all really just different terminology for the same procedure, which is repairing the hole inside of the nasal septum. How's that procedure performed? Well, the basics of it are we're recruiting healthy tissue around the perforation, freeing it from its attachments to loosen it up, and then we're closing the perforation on both sides and typically putting a cartilage graft in between the two repairs so that we get the best results. Now, if you want to find out all your options for repairing a septal perforation, I recommend you coming in for an evaluation to the septal perforation specialist and seeing what your options are, because you may be a candidate for a very minimally invasive procedure that requires no incisions, no bruising, no fracture, no broken bones, and quick recovery. So patients who come in and get evaluated very quickly for surgery often are offered a pretty minimally invasive procedure for them, and they recover very quickly. If we wait till the perforation is very large, that typically involves a more extensive surgery, maybe an open rhinoplasty approach to heal or get access to the nose so that we can recruit enough tissue so that the perforation will heal, and the recovery time is a little bit longer. So again, I encourage you to get evaluated as soon as you know that you have a perforation so you can get the best outcome. So how do they fix a perforated septum? Well, believe it or not, there's about 10 different procedures that are available to the surgeon to address a septal perforation. Which one's the right one for you depends on a few factors. One, the cause of the perforation, the size, and how long the perforation has been present. Your age may come into play as well, as younger patients may heal faster and have a quicker recovery than, let's say, an older patient who's had a perforation for maybe 20 years. I recommend that you come in for an evaluation as soon as you know your diagnosis or as soon as you suspect that you may have a septal perforation, so that we can give you all your options for treatment and get you on the road to recovery as soon as possible. How do I know if I have a hole in my septum? In other words, how do I know if a septal perforation is present? Well, a good way to find out is you can take a flashlight, look in the mirror and shine the light, and if you see it coming through very brightly on the opposite side of your nostril, then you may have a septal perforation. Sometimes a bright light can be seen through the septum itself, and that might appear a little red in color, but a bright yellow or white light shining through the septum and visible on the other side pretty much diagnoses that you have a septal perforation. If you want to make sure, you should come in and see an ENT doctor or a septal perforation specialist, and they can make the diagnosis with a nasal endoscopy, which is a small camera that goes inside the nose and magnifies the septum and lets you diagnose even very small perforations. And then you can make a plan moving forward from there. How would I get a hole in my nose from coke or cocaine? Well, cocaine is a vasoconstrictive medication. It causes the blood vessels to constrict, and it pushes all the blood and oxygen out of the nose. When that happens repeatedly over many episodes, you get an area of the septum that is basically strangulated from all of its blood supply. So that cartilage has no ability to get oxygen or nutrients. Over time, the mucosa in that area, or the lining of the septum, it really dies, and then the cartilage underneath dies as well. That leaves a hole from one side of the nose to the other, and that's called a septal perforation. This can happen very fast. One-time cocaine use can lead to a septal perforation. Those who go on binge cocaine usage can also get a perforation in a short period of time, in less than 1 week. It doesn't have to be a patient who's using cocaine chronically over many years. One time and you can get a septal perforation. Is a septal perforation dangerous? In and of itself, a septal perforation isn't dangerous by it being present. However, the symptoms of a perforation can be problematic in the future. And some of the most problematic things that you can have with a septal perforation are recurrent, chronic infections that lead to destruction of cartilage outside of the perforation itself and potentially collapse of the nasal skeleton and deformity of the nose. This is a rare complication, but it is possible, and it's seen more commonly in patients that have a history of substance abuse, such as cocaine. What is a perforated septum surgery all about? Well, in a perforated septum surgery, what we're trying to accomplish is, simply put, closing the hole in the septum. That will involve closing the perforation on one side, placing a cartilage graft in the center, and then closing the mucosa on the other side. So it's a 3-layer repair. That gives the best results. If you only do 1 layer on one side, you can do a quicker operation, but the chances of failure are very high. So the technical aspect of the surgery is really making sure you have a 3-layered repair, which leads to a high success rate. The surgery is typically outpatient. It is under general anesthesia. It doesn't involve breaking any bones. Many times it can be done endoscopically, which does not require any incisions on the outside of the nose. And the recovery is about 3 to 5 days. So I encourage you to seek out a septal perforation specialist, come into our office for an evaluation, and learn about all your options for surgical repair of your septal perforation. So what are the causes of a septal perforation? Well, the most common cause, believe it or not, is nose picking or surgery. So surgeries that can cause a septal perforation are a rhinoplasty, a septoplasty for deviated septum, or sinus surgery, where sometimes the surgeon may move the septum so they have better access to the sinus cavities. Those are the most common causes of septal perforation. Other causes include drug abuse, prescription medication abuse, such as nasal sprays, like Afrin is the most common one, or allergy medications, such as Flonase. Some obscure causes of septal perforation are hospital admission, where a nasogastric tube is passed through the nose, trauma, like if you have a broken nose or a nasal fracture and it's not treated, you can develop a blood clot inside the septum, which can cause a perforation. And then one of the rare causes of septal perforation is autoimmune disease. So there's some granulomatous vascular diseases that can cause a compromise of blood supply in the nose and cause a septal perforation. So it's kind of a wide variety of reasons for a perforation, but I would say the 2 most common are going to be nose picking and a previous surgery on the nose itself. So if you fall into any of those categories, it doesn't really matter what the reason that you have the perforation. The most important part is probably getting evaluated as soon as possible so you can get a treatment plan and get things corrected and move forward with your life. What does a perforated septum look like? Well, simply put, it looks like a black hole. You see, when you look into the nose without a light, you'll see area of pink mucosa, and then you'll just see this dark opening, and that's usually a septal perforation. To confirm that, if you shine a light inside the nostril, which many patients do at home, making a self-diagnosis, you'll see a bright light shining through to the other side of the nose. When you come into the office, we'll kind of do a formal exam with nasal endoscopy, which is a magnified camera that's on the end of a string that we can look into the nose and really examine the perforation, measure it, and tell you what your options are for healing and moving forward with surgery. What is a septal perforation plug? Well, the more common used terminology is the septal button. And it's basically a silicone plug or a disc that goes on one side of the nose and another disc goes on the other side, and they kind of snap together in the center of the perforation. The purpose of that is to essentially plug the hole or cover the perforation so that the air can flow through the nose evenly on both sides. What are the benefits of that? Well, if you are having a lot of crusting or nosebleeds, or you're having a lot of pain, or you're getting recurrent infections from the perforation, kind of covering that area and sort of protecting it really can help you relieve a lot of your symptoms. The unfortunate thing is that those plugs or those septal buttons can become a pretty high nuisance for the patient because they build up mucus, they can become crusted, they can shift their position, and sometimes they actually kind of piston back and forth or slide around inside the perforation and can actually damage more tissue. I don't mind them myself as a temporary measure while a patient is waiting to have a definitive surgery, meaning something's going on in their life right now. They're having a lot of symptoms. They plan on having a surgery, but they need some help in the interim. I think those patients are good candidates for the temporary use of a septal button. I'm not a big fan in using septal buttons permanently because I've seen a lot of patients who've had chronic infections because of the button, or the button is not well sized and kind of shifts around inside the nose, causing more damage over many years. And the patients end up having to remove them and then have surgery anyway. So my recommendation is that you get an evaluation in the office. We can tell you what all your treatment options are, and it'd be preferable to just have a definitive treatment, which would be a surgery to close the perforation and then allow you to kind of move on with your life and not have to worry about having a hole in your nose or managing a septal button for the rest of your life. So as soon as you know that you have a perforation, even if you already have a button, I would encourage you to come in and see if you can have it removed and have a surgical repair of your septum so that you won't have to deal with this forever. What is a septal perforation? A septal perforation is a hole or an opening in the center divider of the nose, which is called the nasal septum. It's responsible for dividing the nose into a right and left nasal cavity, and it helps the airflow through the nose normally without any turbulence.